Good morning everyone. I am Dr. Aravinda Lochani, consultant neonatologist at KIMS Cuddles. Today we will discuss about the most common complaint for which parents come to the hospital, that is the fever. Fever is the most common symptom for outpatient department visits. Fever is the most common complaint in children. Generally, fever is a response either to an infection or an inflammation inside the body. Fever is a symptom and not a disease. So, what is the normal body temperature?
98.6 degrees
Fahrenheit or 37 degrees Celsius is considered as the normal body temperature. Any temperature which is more than 99 degrees in the axilla should be considered as fever in a child. So whenever you feel that a child is febrile, you can use either a digital thermometer or an infrared thermometer, even though the digital thermometer is the most accurate method of measuring the temperature in a child. So the mercury thermometers are obsolete now, they are no longer being used, and infrared thermometers measure the temperature on the forehead of a child. These values are also not accurate and they are generally used for mass screening like in a hospital based setting. At home, the digital thermometer can be used to measure the axillary temperature in a child. So when this is more than 99 degrees Fahrenheit, we can consider that the child is having fever. The most common causes are viral infections, sometimes bacterial infections, and some inflammatory conditions also lead to fever. Post vaccination also a child can get fever, and in dehydration, and some rarer conditions like autoimmune conditions and malignancies. But the viral and bacterial infections are the most common causes of fever in a child. So whenever the child is noted to have fever, you have to take care of the child by the following measures. So first is give the child to wear light loose fitting cotton clothes and hydrate the child, give frequent small feeds to the child, and fluids frequently should be given. And whenever the child is having fever, fever medication should be given. So the most commonly used medicine is paracetamol. The dose will be given by your pediatrician, so which changes according to the body weight of the child. Suppose if you have a paracetamol syrup which you have used for your elder sibling, you should not use the same dose for the younger child because the dose will vary according to the body weight. Then some other medications are there for high grade fever, which is more than 101 degrees Fahrenheit axillary temperature in a child, like ibuprofen and mefenamic acid, which should be taken only with the advice of a pediatrician. So tepid sponging, which is sponging the child's skin with lukewarm water, can also be done. This is called hydrotherapy. This helps in reducing the fever only up to 30 minutes and can be used in addition to the medication, that is paracetamol for the child. So whenever the child is sick, what all symptoms you have to observe and when you should reach to the hospital immediately. So if the activity of the child in between the fever episodes is good and the child is able to eat well and playful in between the fever spikes, then you can observe at home and give these medicines and refer to the hospital when needed. So when the child is lethargic or drowsy or irritable or is having headache or is having high grade fever more than 101 degrees centigrade and is not able to eat properly, then you should immediately come to the hospital. So these are the common symptoms to watch for in your child. There are many viruses which cause fevers like influenza A and B, adenoviruses, enteroviruses, and measles and chickenpox. Measles and chickenpox are associated with rashes, and also hand, foot, mouth disease also causes few small rashes on the body of the child. So these are the common viruses which cause the fevers. Some viruses have treatment like influenza and respiratory syncytial virus. So these can be evaluated, and the appropriate treatment can be taken with the help of your pediatrician. So whenever the child is having symptoms of complicated fever, then you should immediately reach to the hospital to rule out other causes like bacterial infections, urinary tract infections in a baby. Any baby who is less than 3 months old with high grade fever should be immediately evaluated at a hospital. There are many vaccines which can help prevent these common infections like influenza, typhoid, hepatitis A and B, varicella, that is chicken pox, and measles, mumps and rubella. These can be taken at appropriate times with the advice of your pediatrician. And there is one more entity called seizures in a child, which is called febrile seizures, which happens between 6 months to 5 years of age. So if that is the case, then you can get once evaluated by your pediatrician to take the appropriate medicines. It's better to avoid sending the child to school because the child may become dehydrated, or in the case of high grade fever, if the fever worsens when the child is at school, so it may delay the immediate medical treatment. And also most of the fevers are contagious like hand foot mouth disease, measles, chicken pox. So whenever the child is having any of the symptoms of fever, cold and cough, it's better to avoid sending them. Thank you.